Good afternoon, everyone, and welcome to the IHIMA Student Open House. We're thrilled to have you here today as you embark on the exciting journey of joining the field of health information. This is a pivotal time in your career, and we want to ensure that you are equipped with the knowledge and resources you need to succeed. As you may know, health information is an evolving field, and it offers a wide range of opportunities for growth and impact. Whether you're passionate about data analytics, health informatics, or the management of patient information, there's a place for you here, and we want to help you find it. With that in mind, we have carefully selected today's topics and discussions. Each one is designed to provide you with practical insights and tools that will be beneficial as you transition from the classroom to the professional world. Our goal is to support you not only in mastering the technical skills, but also in navigating the nuances of the industry. You'll hear from experienced professionals, learn about industry trends, and get tips on how to stand out in a competitive field. We've chosen topics that reflect the most current needs and challenges in health information, and we hope these sessions will empower you as you take your first steps in your career. This is also a great opportunity to network virtually with peers and mentors, so don't hesitate to ask questions in the chat. This will allow you to make connections and soak in as much as you can. Remember, you're not just joining a profession, you're becoming part of a community that is committed to improving healthcare through the power of information. My name's Nicole Coots, and I'm honored to be the MC for today's event. I've worked in health information for 25 years and graduated from what is now IUI in 2008. Thank you again for being here today. We're excited to support you as you grow, learn, and thrive in health information. Please note, if you have any questions at any time, put those in the chat. We will do our very best to answer questions. Our agenda today includes a welcome from your IHIMA 2024-2025 President and Student Liaison. Following that, we'll shift our focus to AHIMA. Up next, we'll give you a full rundown of IHIMA, including a special contest announcement. We will engage with industry experts to explore emerging areas in health information, followed by a panel discussion around newcomers in the field. This event will then conclude with some closing remarks. Here to start our event is Jamie McGowan. Jamie is the CDI Coding Director for ECU Health in North Carolina. She is an adjunct faculty at IUI teaching ICD-10 and CPT. Prior to joining ECU Health, she was with Community Health Network for 9 years, serving as the hospital coding manager. She's been an active board member for IHIMA, serving as Southern Indiana Health Information Management Association's president, as well as professional development chair. She is currently the 2024-2025 IHIMA president. Please welcome Jamie McGowan.
Thanks, Nicole. You make me sound so much fancier than what I am. I'm super happy to be here today, and I want to thank the Member Relations Committee for putting this on. I believe this is our first student open house, so super excited to have you all here with us today. If you don't know about IHIMA, I'm hoping that you will know after this call. I want you all to know that you guys are the future of IHIMA. So we want you guys to interact, ask questions. We'll give contacts information after the call as well. We were all one of you at one time, so feel free to speak up. And that's about all I have.
Thank you, Jamie. Appreciate you being with us today. Erica Jones is also here with us today. Erica is your 2024-2025 student liaison. Erica, would you like to introduce yourself?
I sure would. Thanks so much, Nicole. Can everybody hear me okay? I'm
Yes, ma'am.
Erica Jones, and I am a current senior at IU Indianapolis, and I am enrolled in the medical coding program and plan to graduate in the summer of 2025. After that, I'm going to be pursuing a further degree in health information management. And like Nicole said, I'm currently serving as the student liaison this year for the IHIMA Executive Board. I'm really thrilled to be part of this event. Thank you, Nicole, for putting this all together. I look forward to connecting with each and every one of you. Um, if you are currently enrolled or considering enrolling in an HIM program, I'm more than happy to be a resource for you. If you have any questions that you'd like to ask, please feel free to reach out. A good email for me to do that would be memberrelations@ihima.org, and I will be putting that information in the chat for further reference. Thank you so much for attending. Enjoy this event.
Thank you, Erica. So let's start talking about AHIMA, our parent organization. So AHIMA is a global nonprofit association representing health information professionals who work with health data for more than 1 billion patient visits each year. IHIMA is an affiliate of the American Health Information Management Association. The American Health Information Management Association has served the needs of healthcare professionals for more than 90 years. IHIMA informs and advances health informatics and develops professional guidelines for the medical billing and coding industry. IHIMA leads the way in education and advocacy to improve care at reduced cost for healthier populations. IHIMA grants certifications and credentials to health information professionals and approves programs in the field. IHIMA offers career planning tools, apprenticeships, mentor programs, and merit-based scholarships. IHIMA works with college administrators and government officials, along with healthcare and health information professionals, to advocate for health informatics and develop resources for students and professionals. The association offers extensive resources and training opportunities, including online and in-person conferences, a print journal, an online library, and regular field updates. The Commission on Accreditation for Health Informatics and Information Management Education, or CAHIM, is the accrediting body for AHIMA. Schools meet rigorous requirements for competencies and curricula. Students graduate prepared for employment immediately after completing AHIMA certified programs. So now we'll talk about IHIMA. IHIMA is a nonprofit healthcare professional association representing over 1,500 credentialed Hoosiers with more than 200 student members from 10 CAHIM accredited programs. The primary purpose of IHIMA as a member association is to commit to the excellence in the management of health information for the benefit of patients and providers. The mission of IHIMA is to lead the advancement of quality health information by empowering people to impact health in Indiana. The vision for IHIMA is to be the recognized leader advancing trusted health information in Indiana by connecting systems, people, and ideas. See if we can get this video to work. Jessica, give me back share. Why not? I think I have it fixed. Now we'll see if we can do this. Now let's try to watch a video from some of our legacy members. Let me know in the chat if you can't hear it.
I've actually been in this industry over 40 years now.
Almost 41 years.
50 years. Over 20 years. This will be my 41st year.
40, 50 years, I've lost count.
What I've learned over the years is there's nothing that you can't do with this particular degree. I feel like if this profession wasn't here, the whole industry would struggle.
There are places that have realized the value and the strength that HIM professionals can bring.
We are the ones who are actually in the trenches managing the operations of the business of healthcare. And we all have a piece and a part of that.
I started off as a file clerk at a hospital in Michigan City.
I was a non-information clerk at a state hospital.
I was VP of Administrative Services, which included physician practice operations.
I've written many books for the American Medical Association. I've written books for the Society of Critical Care Medicine. Spent some time doing coding,
Data quality coordinator, being over scheduling, registration,
education, revenue management.
help write curriculum and help maintain the IHIMA accreditation.
We've done over the years, the number of challenges have been insurmountable, and keeping information confidential and enforcing confidentiality standards not only on the local level but nationally.
So we went from being totally paper-based. Computers weren't really around. We had some glorified typewriters.
And now we're pretty much all electronic.
DRGs when I first started. I mean, that was huge.
When we went to the DRG system, that was the payment system.
HIPAA, of course.
HIPAA really raised, I think, the awareness level of the knowledge base of HIV people.
And then ICD-10.
ICD-10.
Think of when ICD-10, the coding system went from ICD-9 to ICD-10. So that was a big moment for everyone.
One thing that I've noticed that has been true throughout is protecting patient privacy and security.
If not for us out there doing those kinds of jobs, I would work that information is not the caliber.
Our roles are just as vital as a physician or a surgeon or a CEO or a CFO, because without our expertise and our knowledge in whatever area that we excel in, it's necessary in order to keep the business of medicine running. Because healthcare is so vast, every health information administration professional that I know of has the capability of doing anything they put their mind to in this industry.
Thank you for being the legacy of HIM.
Okay, let's talk about the benefits of membership. As a student entering the health information field, both IHIMA and AHIMA offers a wealth of opportunities to support your professional development. As a member, you will gain valuable resources such as educational webinars, professional certifications, workshops, certification prep, and industry news that keep you updated on current standards and best practices, including new this year, IHIMA's podcast, HI Hub Indiana Edition. You will also have the opportunity to participate in robust networking opportunities, connecting you with community professionals, mentors, and leaders to support your career development. Connecting with a community of healthcare professionals across Indiana and beyond builds valuable relationships for collaboration and growth. In addition, membership provides discounts on conferences, seminars, and other events, allowing you to expand your knowledge while saving on costs. IHIMA offers a mentor-mentee program to help you as you determine your path in health information. All you do is go to IHIMA's website and sign in to apply for a mentor. You can also discover your next opportunity on our job board, your go-to resource for the latest career opportunities in health information in Indiana. IHIMA presents several annual awards, including the Rising Star Award, which honors exceptional new talent in health information. To be eligible, you must be an IHIMA member who graduated from a CAHIM accredited program in Indiana within the last 3 months or a newly credentialed professional within the last 7 years. IHIMA also offers several academic scholarships that are available for students. Eligibility requirements for undergrad students include CAHIM accredited program in Indiana and an IHIMA member, and must maintain at least a 3.0 GPA on a 4.0 scale. Eligibility requirements for graduate students include that they must be a credentialed health information professional and hold a bachelor's degree, and must be provisionally accepted or enrolled in an accredited college or university as a full-time or part-time student, with the course of study being relevant to health information management. You must be an active member of IHIMA or reside or work in the state of Indiana and have a GPA of 3.0 on a 4.0 scale. So, to apply for scholarships, go to ihima.org and visit the member sections under awards and scholarships. Applications are currently open and will close December 1st. New this year, IHIMA is offering a new graduate scholarship, which recognizes stellar graduates from CAHIM accredited HIM undergraduate or graduate degree programs in Indiana. This scholarship program reimburses the certification examination fee for RHIAs or RHITs. Each educational program director or designee may select one graduate per academic year to receive the scholarship. Eligibility requirements for this include that the student is enrolled in a CAHIM accredited HIM/HIT program in Indiana, is an IHIMA member, and a 3.0 GPA on a 4.0 scale. Program directors will submit directly for this scholarship. Advocacy is another vital role in health information. Advocacy is vital to achieving the health information professional role in ensuring patient health information is accurate, timely, complete, and available to patients and providers. Being an effective health information management advocate goes beyond contacting legislators when a critical bill is on the floor for a vote. Advocacy is a year-round commitment, building meaningful connections with decision makers at every level, making relationships we can draw on when the time comes to advocate for a bill or issue. Let's watch a short clip from one of IHIMA's past Hill Days.
Nicole, can you turn up your audio? It's hard to hear.
It's a lot of it though. It's just music. So advocacy in action. IHIMA members traveled to Capitol Hill to engage with congressional offices advocating for the Match It Act of 2024 and the impact of AI in the non-clinical workforce. Be part of IHIMA's efforts in contacting legislators on concerning key initiatives. To learn more, go to ihima.org/advocacy. So this is one of the cool things that I've been able to participate in with IHIMA. IHIMA members, including myself, went to Washington, D.C. earlier this year to talk with our legislators, and these were our two key initiatives. One in particular is near and dear to my heart, as I am a data integrity manager by day. The Match It Act of 2024 continues to gain support in the U.S. House of Representatives, with 11 co-sponsors, including James Baird from Indiana, who, after meeting and discussing with us, signed on to co-sponsor this legislation. Hey, that's very, very exciting, isn't it? You're probably thinking, okay, so how can I be part of all of this? So the Indiana Health Information Management Association is a component association of the American Health Information Management Association. So to join IHIMA, you have to be an active member of AHIMA and choose Indiana as your state association. If you do not live in Indiana, you can still choose Indiana IHIMA as your state association when you renew your IHIMA dues. There are no separate state dues to belong to IHIMA. Just pay your IHIMA dues.
Hey, Nicole, I'm sorry, I'm going to jump in here just a second. So going to looking back at Hill Day as a student, I can only imagine you're probably thinking that looks so overwhelming, and you may be thinking I could never do that, or I don't know if I could do that. And that's one of the things that kept me from going, was just that. But then when I got there, it was such a cool experience. Even if you go to observe, just to see what it's all about, it is exciting, and it got me thinking, why can't it be me? And why can't I be there representing our profession? So I know there's probably a few of you that are sitting there thinking that's way out of my realm, but it's really not. Just get involved. The more involved you are, then the more comfortable you'll begin to feel.
Yeah, and I would add, Jamie, the more seasoned, you'll have more seasoned professionals with you. You're new to the IHIMA, we don't just throw you out there. We do have several seasoned members that will guide you through that process as well. Yeah. All right, now to the important stuff, money. So if you could describe the future of the health information management field in one word, what would that be? Send your reply to member relations at IHIMA for a chance to win a $100 gift card. Now we're going to talk to some experts. Our first speaker today is Cameron Murphy. Cam is a combat veteran with 20 years of experience in leadership, cybersecurity, IT, metadata analysis, executive briefing, and project management, holding an active top secret security clearance. He is currently the Security Operations Center Manager for Booz Allen Hamilton, supporting the U.S. Government Defense Finance and Accounting Services Agency. His former professional experience includes Director of Cybersecurity for a managed security services provider and lead cybersecurity engineer for Raytheon Technologies. Welcome, Cam, and thank you for speaking with us today.
Thank you, Nicole. My pleasure. I hope everyone can hear me okay. Give me a comment in the chat if you can't. I do have chat pulled up, so if there's any questions at all, let me know right away. I'd be much more interested to answer your specific questions as those come up. So I do have that up and monitoring. But what I hope to talk to you about today is some alternative careers within healthcare, specifically related to information security. Information security is a massive part of the healthcare industry, as it is with all industries, but healthcare being uniquely important for a couple of reasons. You probably already know, but there's a lot of information security jobs in the healthcare industry, specifically to healthcare. There's a particular role called a HISO, a healthcare information security officer, which is more synonymous in the other industries where you would normally have a chief information security officer or a CISO. There's also compliance officer opportunity roles, security analyst roles, privacy officer, and healthcare IT auditor. There are several other information security roles, but just to give you the top 5 there. I do think there's some important cybersecurity aspects to healthcare. For one, healthcare industry continues to be the top target for threat actors, and for a few reasons. So healthcare organizations, they're a target-rich environment, a prime target for attackers for multiple reasons. One, healthcare facilities are well-funded and well-insured. Attackers know that. Healthcare industry has insurance specifically to help them get out of ransomware attacks, to restore from a disaster. And for those reasons, they're highly targeted. For the other reason, which may be more obvious, is the PHI and PII that healthcare organizations hold. That information in itself, if compromised by a threat actor, becomes very, very valuable information. So cybersecurity compliance in healthcare, I think everybody understands HIPAA is a big part of healthcare and basically rules everything as far as cybersecurity controls, information handling, the standards of handling PHI and PII. So don't have to get into that, but it's obviously a big part of information security within healthcare. There's some basic cybersecurity practices that you're obviously going to see throughout your career, but not limited to multi-factor authentication, data encryption. All PHI, all PII at rest should be in an encrypted state. So if you ever find PHI moving around your organization in a manner that's not encrypted, be the one that raises the flag on that and be the one that raises the concern to ultimately get to resolving that. Just some recent stats on PHI and PII breaches, specifically in the healthcare industry. The healthcare industry accounted for 60% of all reported data breaches in 2023. So the vast majority. That's just huge to me, hearing that number 60%. And by the way, over the last 5 years, healthcare has had the lion's share of reported breaches from all other industries. So, and the root causes are always the same. It's phishing and social engineering attacks make up the plurality of those breaches, 40% in fact. And then of course, there's other ways that those breaches occur: insider threats, either accidental or intentionally. And then there's also, as Jamie McGowan said, she's worked remote for the last 10 years, so way before it was the cool thing to do. Those remote accesses require certain technologies. In 2020, as those technologies had to get rolled out quite expeditiously, corners were cut, and it was a whole new line item. It was a new cost item for a lot of organizations. So not only were corners cut for the sake of expediency, corners were cut for the sake of financial reasons. So we don't have the best remote access options at every organization, though there are some top tier ones that maintain a secure access environment. So definitely something to consider. Typically when these breaches happen through not one of those top 3 means that I mentioned earlier, it's normally a lapse of security controls somewhere in that data access chain. Now, who would I be? How could I be a bona fide cybersecurity professional speaking at an event like this if I didn't say the two most popular letters of 2024? AI. So AI is just pervasive now. It's making its impact in every single industry now, healthcare again being no exception. The obvious benefits of AI is it reduces costs. It makes everything more efficient. But one of the other benefits is that it increases provider availability. So the less time that a provider can spend writing notes for a patient that generative AI can perform, that's definitely a great positive impact to patients. Some would argue increased accuracy. I think AI is still at the point where it needs to be fact checked, but not to get too much into the benefits of AI. What I want to try to cover is some of the negative impacts of AI. So not to be a scare tactic or a naysayer of AI, I use AI myself every day. A lot of our cybersecurity tools that detect alerts are, AI driven, what we call AI. And by the way, AI is really, just understand that it's fancy programming. It's really good programming. It's really good scripting functions stringed together to make decisions that appear to be a stream of conscious thought. But it is programming. So some of the impacts to cybersecurity, or sorry, to healthcare industry because of AI is because AI has led to some significant breaches in healthcare industry. And breaches in the healthcare industry, like I said, there's 60% of breaches are in the healthcare industry. So should go without saying that that's also the lion's share of the costs of breaches. There's several legal implications anytime there's a breach of PII, PHI, not to mention the patient trust that's lost. But just to give you some recent examples of breaches caused by AI, Kaiser Foundation healthcare plan in 2020, this year in 2024, it was an automated tracking tool that was designed to speed up the processes, make things more efficient. It was an email system that was automated. Unfortunately, it was misconfigured. And what it did is it led to unintentional data spillage of PHI to over 13 million unauthorized parties. And some of those unauthorized parties were individuals. Some of those unauthorized parties were massive corporations like Google and Meta and so on. So that is a massive effect. All the best intentions in mind, but sometimes unchecked can, or improperly checked, can lead to those types of incidents. AI is also being used nowadays for phishing attacks. So, we've all got the phishing attacks over text message or email, but now AI has done a really good job crafting those responses, and they're getting a lot better. So I see them, virtually all day. I see them, and they're getting really good. And the reason I see them is because users are still falling for them. And it's hard to blame them, and it's really hard to teach. So you need to make sure that you have really good processes in place anytime you're going to use AI. There was a recent example of ChatGPT last year, in its infancy phases, basically led to a massive spillage as well. But all of that to say, as a healthcare information professional, you're going to come across AI. You're going to come across automated processes that use generative AI or are designed to basically make your job more efficient, more effective, allow you to cover a much wider range of responsibilities, as most businesses are requiring now. That's not unique to healthcare. But whenever you find these AI processes in place, or you're asked to support moving AI into your organization, make sure that it's done in a secure way. Who's developed that AI? What are the servers involved in that AI? Where are those servers involved? Anytime you have AI, you're going to have internet connectivity and data moving across the internet. You have to know the path that information is traversing. You also have to have a good policy based around what kind of information you can put into that system and what kind of information you should not put into that system. So there's a whole lot of implications in using AI. And I hope that everyone comes to understand how it all works rather than just simply using it and trusting the process. That's not to say trust nothing, but question everything for sure. So my call to action for you is, as the next generation of healthcare professionals, you have the unique opportunity and really the responsibility to lead the development of this new technology. You have the call to action to safeguard your businesses, your organizations that you'll be working at, but most importantly, your call to action is to protect your patients, ensuring their information is safe, their PII and their PHI. And finally, I hope that all of you as students, I hope that you lead us into a future where healthcare innovation continues to thrive. Don't let naysayers like me dissuade you from using these new technologies. Please use those technologies to make us safer and more secure. So with that, I thank IHIMA for your time here, for the opportunity to present. I'm standing by for any questions, should there be any. But otherwise, thank you so much.
Thanks, Cam. Our second speaker for today is Jill Alfrey. Jill Alfrey is currently the inpatient hospital coding manager with Community Health Network, going on her 23rd year in health information. Jill started just out of high school in June 2002 as a chart analyst, went to school for her bachelor's degree in health and human sciences, graduating in 2014, and pursued a coding career shortly after. For the last 10 years, encouraged by her drive for improvement and helping others, Jill held the hospital coding supervisor role that in 2022 led to the hospital coding manager role. Currently, she holds her RHIT and CCS. Welcome, Jill, and thank you for talking with us today.
There we go. Thank you. Can you hear me okay?
Yes.
We can.
Okay. I'll share my screen. I have a couple slides, but I'm going to kind of piggyback off of what Cam was talking about and share some AI well, hold on just a second. AI in HIM. HI professionals are already seeing AI being probably thrown at them every which way. I know I get thousands of emails every day about it. And so there's just a lot that is coming out that is being discussed in our industry. Can you see my screen now?
We can, yeah.
Okay, thank you. All right. So the pace of innovation in HIM is just gonna continue to grow leaps and bounds. We have always kind of had a little bit of AI. Let me get this box out of the way. Oh, sorry. And I'm a hot mess, sorry. Okay, there we go. So the artificial intelligence for the health professionals, we are, there's lots of systems out there already using a lot of automation, which I think a lot of people confuse automation with artificial intelligence. But both obviously are very important to our industry because a lot of what we do is manual input, and it's something that can be automated and take that off of the HI professional so that they can work on something that's a little bit more task efficient or more detailed. And then there's also branches of AI, I guess you could say, that include natural language. And then there's also different deep networks, which just goes way further into it, and the subset, which just makes AI a little bit more breakdown and obviously has a little bit more interaction with the system and can do more on its own. So the natural language processing systems are definitely being used in CAC because they learn based on how coders are using the system. But then we also have autonomous coding, which is coding completely from just the documentation, and it goes through automatically without anybody having to put their hands on it. And then there's dictation systems. Of course, they transcribe automatically, query opportunities that are coming from different systems now that are reviewing nationwide query opportunities so that they are making sure that they're getting everything. If, something is becoming more detailed or specific with the codes, we want to make sure we're capturing that. The denials, definitely denials. A lot of payers are using AI to capture just one diagnosis specifically to then go in and deny the whole claim. So they're definitely using it. And then we are also seeing automated finding letters and now appeal letters. So they're definitely coming to the point where it can pull in information from the charts and process and then develop the letter so that you can tweak it a little bit, but for the most part, hopefully not have to have too much direct interaction with it. Securing those AI systems, so that's probably the biggest issue. Obviously, we are hearing about it left and right. As Cam was going on about cybersecurity, there's, we've had massive breaches to one Indianapolis hospital specifically, but so there's obviously confidentiality and trust that we have to build within these systems. And a lot of times that doesn't come right away. I mean, that comes with time and experience, and the more that they develop the product into what we need in healthcare. And then there's also just the balancing of the privacy, because anybody can access it. And as we're seeing now, like even help desks are starting to be, basically they're getting people that are calling in to have their reset their credentials, and then they're able to access our systems. And that it could include payroll, it could include a private information as PHI, social security numbers, bank information. So it's very scary, but at the same time, it is the world we live in. So it's going to continue to grow, and it's just important that professionals in health information just remember that keeping everything secure, locking your computer down, having those detailed passwords, those are all part of putting that forward and making sure that you're keeping that information safe and not giving it away with just a few, somebody who could guess your password pretty easily, or you've given it to somebody, that's why we don't share. But it's really, this has probably been something that I've heard more and more, but it's because it's not if it happens, it's when it happens. So you want to be prepared, and you want to take all the precautions you can ahead of time, which is where the mitigating risk factors comes into. So a lot of technologies, they have to be designed, developed, deployed in a manner that's ethical, equitable, responsible, and transparent. So has to meet a lot of little thresholds, a lot of check boxes, but that's for safety and security. And then limiting the risk, that way we can understand how they're applied, how they're used, what they're used for, what is impacted when they are being used. And then just making sure that the agripherums and those, just things that are pulling in the information like CAC is being built because of how your coders are coding. So you want to make sure that accuracy is there, because if the system is learning the wrong things, it's not doing any good. And right now, I mean, they are definitely pushing the guidance for the regulatory agencies to kind of put guidelines on AI, because right now it's just kind of a free-for-all for certain areas like payers. They can use this, but there's a lot of articles now that you see where they're getting in trouble because they are denying everything without even really reviewing these claims. And that's not what the process is supposed to be. So, just a lot of different ways that this is starting to branch out in healthcare. So I wanted to just kind of bring your attention to some of those things. Keep keep in mind that you are in HI, but so that part of your profession is growing, and it's always good to learn about the data analytics or the security that goes into these systems that your facility may use in the future. Anybody have any questions? Okay, thank you.
Thanks, Jill. Our next speaker today is Jessica Carson. Jessica Carson is an RHIA and a dedicated professional with over 10 years experience in the health information field. Jessica is a proud graduate of Indiana University School of Informatics, where she earned her degree in health information administration. During her time at IU, she served as secretary and later president of the Informatics Student Government and demonstrated her leadership early in her career. Since 2006, Jessica has worked at Community Health Network, contributing in a variety of roles across the continuum of care. Currently, she works as a senior application analyst in the Information Technology Department, a position she has held since 2015. Jessica's expertise is backed by EPIC certification in multiple areas, including hospital coding, release of information, deficiency tracking, identity, hospital billing, and Cogito fundamentals.
Cogito.
Fundamentals.
Pretend like you're saying cookie dough.
Okay. When she's not advancing healthcare IT, Jessica enjoys spending time in her garden, cooking, reading fiction, and cherishing moments with friends and family. Please welcome Jessica Carson.
Thanks, Nicole. And sorry for not giving you a phonetic spelling of cogito. I kind of did not think about the fact that it's not a common term these days. So, all right. Well, thank you guys for joining today and being here for our presentations. Today, I'm going to talk to you guys about some of the less conventional roles that HIM professionals are qualified for and emerging areas where our education can be useful. So typically when we think of working in the HIM field with our RHITs, RHIAs, or coding backgrounds, things like that, we picture things like managing patient records for timely documentation, coding, billing, release of information, privacy compliance. I will say, after you guys heard my bio, that that's not specifically what I do. I work in IT. So I think it's safe to say that, there are non-traditional HIM roles that go beyond the well-known areas. And a lot of the new and emerging areas where we can be impactful in our organizations are areas like data analytics, cybersecurity, IT, obviously, and maybe like project management. So the reason why we can fit into those categories, they still require core HIM knowledge, and they apply our expertise in ways that they just go beyond what we're used to seeing. So some of the ways or the reasons why these career paths are opening up to us, technology integration is one of them, the rise in electronic health records, AI that we've talked about a little bit today, and a lot of data means that our HIM professionals, we need to have a blend of healthcare and technology skills to really be able to keep up on what's happening in our profession and in healthcare overall. Secondly, value-based care is it's a big driver for this change as well. Healthcare is becoming more focused on improving patient outcomes and reducing costs, and this shift really creates a need for people who can make data-driven decisions and support the goals of the organization to make sure that we are still viable, solvent, able to keep our doors open and keep patients healthy. Another one would be interdisciplinary collaboration. We, as HIM professionals, we're collaborating a lot more frequently with IT and legal, our cybersecurity friends like Cam. And as these things converge, it kind of turns into a gray area of, who's HIM, who's IT, who is cybersecurity, because they just all go so hand in hand. Everyone needs to be at the table. And I think having an HIM background and being in IT has really opened up my eyes to how useful we can be on both sides of that. So before I talk specifically about what I do, I did want to give a few other examples of non-traditional HIM career paths. So healthcare data analyst, not exactly what I do. I do work with data analysts and I work with a lot of data. But healthcare data analysts, they do analyze patient data and trends to improve care and make operations more efficient. We have a whole analytics department at our organization specifically for revenue cycle, and they are so helpful. I work with them. Nicole works with them. The whole HIM department leadership. We work with them to be able to get the big pictures that their data analysis has pulled in for us. Another role that I found was health informatics consultants. So they work with healthcare organizations to optimize their use of technology. They can streamline workflows and ensure that data is being used effectively. And they can provide expertise in selecting, implementing, and customizing health information systems. So like our electronic health records, clinical decision support systems, any third parties that we can pair with those two areas, just making sure that we're making the best decision for the organization, because a lot of those third parties can be pretty costly. So we really need to make sure that they are value added to the organization. Another one that Jill kind of alluded to would be like a healthcare AI specialist. So they're focused on integrating and managing the AI solutions within healthcare organizations. They can help develop the AI models and assist with diagnostics, predictive analytics, and the administrative tasks like automating some of our processes in billing and coding. Another one that I think is really interesting is population health. So a population health manager would be a role where they're using health data to track and improve the health outcomes in specific populations, working with healthcare providers to implement preventative care strategies so that we're not seeing a ton of exacerbated asthma. We're preventing those flare-ups. We're finding the trends in population health to say, how do we keep them from having asthma attacks that are life-threatening and cause more expenses, not only to the patient, but to the organization for admissions and things like that. Additionally, to like reducing admissions and preventative healthcare, they can help reduce health disparities among populations. We can find trends where maybe specific areas or socioeconomic status or races there's disparities there that we can identify and help to rectify. Like I kind of alluded to, like the managing chronic conditions, that preventative care and managing chronic conditions kind of all can go hand in hand. So we're preventing the exacerbations, but we're also doing mammograms and we're doing things like that to keep our patients safe. So specifically what I do for my organization, application analyst doesn't exactly explain it, but I am certified in Epic, and I support the actual HIM department users for the workflows that they perform for the organization. So an example would be Nicole, who is one of my end users at Community, making sure that the work lists that they use to find potential duplicate patients in our master patient index, if there's a column that they need added that's missing, I'm able to make sure that it's there. If there's a new workflow that they need for identifying issues in the system and making sure that our master patient index is clean, making sure that chart corrections are being performed if there's documentation errors. I really view my role as a partner to them. So understanding and having an HIM education to be able to be a good partner, understand the requirements and the workflows that they're trying to accomplish. I really feel like without this education that I have as an RHIA, I would not be as effective in this IT role. So that's just a couple of examples of what I do. As you guys heard, I'm certified in multiple areas. So I also, I support like the coding areas, release of information, deficiency tracking, things like that. If you guys have any questions or want to learn more about it, I would be happy to receive information. I'll put my email in the chat. That way, students, if you guys want to reach out to have more in-depth conversations, I'm always happy to do that. The last thing I wanted to kind of cover with you guys is, because I've heard this question a lot when I've talked about non-traditional roles in the past. So what type of skills outside of an HIM education lend themselves to these non-traditional roles? And I would say technical proficiency. So if you're going to be in data analytics or population health, anything like that, understanding the tools that are out there for that, learning SQL, which is a type of coding, would be helpful for reporting. A lot of technical proficiencies, if you're already kind of drawn to that, or you already have a background in that, or if you want to gain a background in that, that'll definitely add to your tool belt with your HIM education. Problem solving skills, definitely very important. Analyzing a bunch of complex data or problems, being able to be creative about how you find solutions to that. You might be able to take a concept from another area in a technical role and apply that to a new problem. So, and not getting discouraged when it doesn't work, being able to go back to the drawing board and try to just get any type of solution out there that is going to meet the need of your people. Being able to be adaptable, healthcare changes so quickly, being able to continuously learn and embrace all of the new technologies that are coming out, all of the developments like we've talked about today. There's so many new things coming. Being able to adapt and change as those final rules come out, or new systems or new technologies. And then the interdisciplinary knowledge, a strong understanding of the areas like IT, law, cybersecurity. It really helps you to collaborate with those areas. It can speed up the process to not have that learning curve. It doesn't mean that you need to fully, know all of the lingo, but just understanding some of that jargon can really speed up those types of conversations where you guys are problem solving, or being able to have a conversation and get to the next point without constantly needing definitions. So yeah, I think that I'm a big proponent for non-traditional roles because I love what I do. And I would encourage you guys to look into those things. And additionally, I want to plug some of the other certifications that IHIMA has. There's micro credentials out there, but then there's also like this, I think it's CDH, I can't remember, but it's the data analytics one. There's a lot of really cool stuff out there. If you guys haven't looked to see what other options there are post RHIA, RHIT coding certificates, I would really encourage that as well.
Thanks, Jessica. Next on our agenda is a new professionals panel. We want to hear from new professionals who got the job. India?
Good afternoon, everyone. I hope you're enjoying today's events. I am India Holland, an HIM professional operating as a clinical DRG auditor and serving as a co-chair of the Member Relations Committee here at IHIMA. I have two recent HIM professionals here to discuss their experiences, Jennifer and Melanie. And I have some questions for you guys. I'll start with Melanie. What were your key areas of interest during your program, and did that change?
Hello.
I'm sorry, excuse me. I should have you guys introduce yourselves first. I'm sorry. Melanie, why don't you go first?
Can you hear me okay?
Yes.
Okay, perfect. So my name is Melanie Grennis. I am a certified coder, so I have my CCS. I work for Community Health Network, and I've been there for 2 years in Indianapolis. And I guess I'll go ahead and answer the question too, if that's okay.
Sure.
When I was a student first, that's when I first started coding. I had no idea what I wanted to do except code because I wanted to work from home. I'm actually a student again, so I'm going for my RHIT because now I'm interested in doing some of the non-traditional things that we were just learning about. So I'm looking at doing some of the data analytics. Whew. talking is hard, guys. But yeah.
Well, thank you, Melanie. Thank you for being here with us. And Jennifer, you can go ahead and introduce yourself and answer that first question if you're ready.
Sure. My name is Jennifer Retzloff, and I graduated the 4+1 program at IUPUI. Did 4 years with my bachelor's in health information management and then finished my master's last year. Early on, I wanted to go into nursing, and the deeper I got into that, realizing the time commitment, I was a stay-at-home mom at the time. So I wound up, I can't even remember, I met with an advisor and wound up jumping into the HIM program, not knowing at all what it was about or what it could lead to. And it was really exciting because there are so many new opportunities, so many of these non-traditional roles available. It wasn't very, just this huge umbrella, lots of different options. So from there, I had the opportunity to sit under different people doing shadows. And at one point in time, I sat under somebody from IU Health, watching them work through some data analytic projects. And it was very interesting to me. It was a project-based work that she was doing. It was problem solving. There were lots of different trails she could go down. She was following the data, and it was like that she was solving this big mystery, and she's creating these fancy spreadsheets and presentations and visual graphics. And I thought, wow, that's totally exciting. I wouldn't have thought about that in any other regard. So just slowly followed that path. And as I graduated, I landed at Franciscan Health. I jumped in with no previous healthcare experience whatsoever, and I knew I would need to add some to my resume. And like Jessica just talked about, our roles as a non-traditional HIM employee, we touch all these different places in healthcare. So I thought it would be good to jump into registration. And registration was awesome because it kind of helped me to learn what that looked like from the ground up. And once I got in, that was about 4 years ago, I started moving around. I moved into collections and denials and eventually landed on our reimbursement team as a contract reimbursement analyst. So we model predictive forecasting data for contract negotiations.
Okay, very interesting, Jennifer. Thank you for sharing. Moving on. The next question is, did you feel prepared for the job after your program? And since I have you here, Jennifer, I'll let you answer that one first.
No, it was intimidating to jump into a role like that, if I'm being super honest. I felt ill-equipped, but once I got into the role, I was surprised at how well prepared I was. I thought, I have no idea what I'm talking about. I don't really know. Like, I think Jessica mentioned the acronyms and having the jargon down. I wasn't familiar with enough of that. And I thought, I jumped into our corporate finance department. So there's a lot of CEOs, CFOs, corporate wide. I felt like a little teeny tiny fish in that pond. And so I felt ill prepared. But at the same time, the more I learned, the more I realized that all of the material that we have been covering in our program was very relevant. So I just had to learn how to study again. I had to tap back into those resources and learn how to apply them differently. But really, all the basic information was there. I was just digging it out and learning how to use it in this new environment.
And how about you, Melanie? Did you feel prepared?
Also no. But again, at the same time, like since I was doing coding, there's coding guidelines, there's things like that they're very helpful once you've known them, you tested on them, you're there. And once you're hired somewhere, everyone's like very excited to train you, like, hello, come in, we'll teach you. So you're there, and I'm actually learning a new type of coding right now. And if you ask my trainer, she'd say, you're doing great, but I'd say, I have no idea what's going on. So, everyone's very happy to help you, even if you don't feel like you have any idea what's happening. But you'll get there. And, I've been doing it for 2 years, so obviously I must be doing something right. So if everyone else can do it too.
I agree. Tapping into the community of all of these helpful professionals who are there, and they want to teach you. They want us to be the best so that they can pass the baton, essentially.
Yeah, I definitely agree with that. Yeah.
Lastly, what did you find to be the best tactics for studying for their certification exam? Excuse me, Melanie.
I use the IHIMA workbooks a lot. I did a lot of that. I found some really helpful people on YouTube that gave me study like strategies, and also strategies to use while I was taking the test because I'm usually a gut feeling test taker, which is not always good. Um, so like I actually ran out of time on my CCS, and that was very horrifying. So um, I wrote some things down too. Oh, practice tests online, actually studying, not pretend studying and saying I'll be fine, um, and doing the having someone else talk you through questions. So if you know someone in your class that you can bounce ideas back off of, that's very helpful too.
Yeah, I've heard that teaching is the best way of studying. If you try to teach someone in your circle what you're learned or what you have learned, I feel like that's the best way to know if you have it or not. Jennifer, how about you? What tactics did you use to study for the exam?
Yeah, I would agree with that. Having a good circle of people that you can study with or you can bounce those ideas off of one another. I sat for the RHIA, so I don't know if you've seen that textbook, but it's like this big. So, I actually did the PDF version to audio so that I could listen to it just nonstop. I was listening and listening and listening, and I can't believe how much of that information came back to me when I was sitting through the exam, but also just traditional study methods, flashcards, and taking it small chunks at a time, feeling like you had kind of mastered a chapter or domain in that practice before moving on. And I don't think it's anything that you can wait until the last minute to study. You can't cram. There's no way to cram for those exams. So being well prepared in advance is important.
I agree. Thank you, ladies, so much for being here and sharing your experiences. I'm hoping there's some students who feel a little better about what is ahead of them because of you sharing. Thank you so much.
Thank you.
And Nicole, if we have time, I would like to share some tips for uh, standing out in the job market.
Of course.
Okay. So standing out in today's job market requires more than just having a degree. It's about demonstrating what sets you apart from other candidates. So I'll just give you a few things to make a lasting impression. So you would want to customize your application materials, meaning tailor your resume and your cover letter for each position you apply to. Avoid generic templates. Show the employer that you've taken time to research the company and understand the role. You will want to highlight specific skills and experiences that make you the best fit for the position. This can include technical skills, soft skills, or any relevant experience like internships, part-time work, volunteer activities, or academic projects that align with the job description. And next, you will want to focus on real-life experiences. Employers value practical experience as much as academic achievements. Internships, co-op programs, and volunteer work can not only help you build your resume, but also show potential employers that you know how to apply your skills in a real life setting. If you have participated in projects or worked with industry, make sure to highlight that in your application and during interviews. And then you want to develop a strong online presence. Most employers will check your LinkedIn profile or even search your name online. So ensure that your digital presence is professional and up to date. A polished LinkedIn profile that highlights your skills, achievements, and professional connections can set you apart. Additionally, if you have a portfolio of work, whether it's writing, design, coding, or research, make sure it's easily accessible online. And showcase your soft skills. While technical abilities are important, employers are also looking for candidates with strong communication, teamwork, and problem-solving skills. Think about how you demonstrated these qualities in past roles or projects, and be sure to discuss them in your application and interviews. And then, while you're here, network strategically. Don't underestimate the power of networking. Connect with alumni, attend industry events, or join professional organizations related to your field. Building a network can lead to job opportunities and valuable advice. If possible, reach out to people and companies you're interested in working for, and seek informational interviews to learn more about the culture and expectations. And then you want to prepare thoroughly for interviews. Once you've secured an interview, preparation is key. Practice answering common interview questions, especially ones that ask about your strengths and weaknesses and experiences. Research the company's history, mission, and recent projects so you can speak intelligently about how you can contribute. Being able to ask thoughtful questions also shows your interest and enthusiasm for the role. Follow up. After applying or interviewing, send a thank you email. A well-written follow-up not only shows your appreciation, but also keeps you on top of mind for the employer. By going the extra mile in each of these areas, you'll distinguish yourself as a proactive, thoughtful, and capable candidate. Every interaction you have with a potential employer, for your application materials to the interview, to follow-up communication, is a chance to make a strong impression. So use them wisely. Thank you so much.
Thanks, India, Melanie, and Jennifer. We appreciate you being with us today. So to end today's open house, I would like to take a moment to sincerely thank all of you, students, speakers, and volunteers for joining us at IHIMA's Student Open House today. To the students in attendance today, we are grateful for your enthusiasm, engagement, and passion for the field of health information. You are the future of the industry, and we are excited to see the impact you will have as you begin your careers. Starting out in any profession can be overwhelming, but the field of health information offers incredible opportunities for growth, innovation, and making a real difference in healthcare. Our goal today was to provide you with insights, knowledge, and connections that will be helpful to help you hit the ground running as you embark on this exciting journey. We know how important it is to guide and support students as they transition into their careers, and IHIMA is committed to being here for you every step of the way. From offering networking opportunities to providing resources for continuing education and certification, we want to be part of your professional growth for years to come. To our speakers and volunteers who helped with today's event, we extend our heartfelt gratitude for sharing your time, expertise, and experiences with our students. Your insight not only inspires, but also offers practical advice that will help these future professionals navigating the complexities of the health information field. Your time and dedication to helping others succeed is truly appreciated. Together, we are building a strong community that nurtures the next generation of health information leaders. Thank you all once again for being a part of today's events. We look forward to supporting you as you continue your journey in health information. Check us out on Facebook, X, YouTube, or even at ihima.org. That concludes today's event, and we're wishing you all the best in your future endeavors. Thanks, everybody, for joining today.